should be written everywhere now. It should just be like it, for people to understand that might give them a shot in, this complex environment.
Yeah, kind of aha moment, right? Like if we understood what was actually happening in our brains, it's a filter through which to observe our own experiences and then actually have agency and take action. That's my hope, exactly. So basically the bottom line is that pain and pleasure are processed in the same parts of the brain. That's a new discovery in neuroscience and very interesting, right? Kind of paradoxical in and of itself. And pain and pleasure work like opposite sides of a balance. Imagine that there's a beam on a central fulcrum. And the way that pain and pleasure are processed is that when we experience pleasure, our balance tips one way, and when we experience pain, it tips the opposite way. And the overarching rule governing this balance is that it wants to remain level, or what neuroscientists call preserving homeostasis. And our brains will work very hard to preserve or get back to homeostasis after any deviation from neutrality. So when we do something that's highly pleasurable or reinforcing, whatever it happens to be, it might be different for you than it is for me. We release dopamine, the reward neurotransmitter, in a special circuit of the brain called the reward pathway, consisting of the nucleus accumbens, ventral tegmental area, and the prefrontal cortex. And our balance tilts to the side of pleasure. But no sooner has that happened than our brains will work to restore a level balance, and our brains do that first by tipping an equal and opposite amount to the side of pain. Now, I like to imagine that as these little neuroadaptation gremlins hopping on the pain side of the balance to bring it level again, but they like it on the balance, so they stay on until they're tipped an equal and opposite amount to the side of pain, and then they get off, and then we go back to a level balance. And the reason that's really fundamental to understand is that for every pleasure, we pay a neurophysiological price, right? It's not for free. And the bigger the pleasure, the bigger the price we pay. And it's stressful on the body to have to work to restore homeostasis. Furthermore, the second rule of the balance is that with repeated exposure to the same or similar reinforcing pleasurable stimulus, that initial deviation to pleasure gets weaker and shorter, and the after response gets stronger and longer. In other words, those gremlins once created, even when they're off of the balance, never go away. They're waiting in the wings to hop on again. And with repeated exposure, they multiply and they get stronger. So soon we end up with enough gremlins on the pain side of the balance to fill the whole room, and they're camped out there. They're not going anywhere soon. And this is the addicted brain, right? We're walking around with a balance chronically tilted to the side of pain, which means we need more and more of our drug to get the same effect. We need our drug not to get high now, but just to restore equilibrium and feel normal. And importantly, when we're not using, we're experiencing the universal symptoms of withdrawal from any addictive substance, which are anxiety, irritability, insomnia, depression, and craving. So when people understand that, they're able actually to mindfully observe how when they're watching one YouTube video after another, it starts to lose its appeal, right? These are the gremlins accumulating on the pain side of the balance. And yet we can't stop ourselves. Why not? Because if we were to stop ourselves, that balance would slam to the side of pain and we would experience dopamine free fall, which is incredibly uncomfortable and which nobody wants. Hence the impulse and the urge to click on the next video and the next video and the next video in order to try to maintain some semblance of equilibrium, but it's a losing battle. The more we press on the pleasure side, the more those gremlins accumulate on the pain side. And eventually, again, we just end up having to either, watch YouTube videos to death or somehow give up and then go into this dopamine deficit state. And again, if we repeat that day after day, we just end up looking like we're clinically depressed, right? Because we've changed our hedonic set point.
And how much, because there's such a proliferation of kind of anxiety and depression and mental health symptoms in young people with perfectly normal lives that don't seem to be experiencing, anything else that's going on that would be extreme. And there was something I wanted to ask about as well, which is the kind of, trauma, which is a